In the UK, the Care Quality Commission ensures accountability and consistency across health services. It monitors providers and licenses and protects patients through transparency and clear standards. The Director of Public Health says discussions are underway to determine how a similar body could regulate health and care in Gibraltar, including decisions on resourcing, staffing, scope, funding and enforcement powers.
We know that we've got a gap in our legislation and regulation here in terms of healthcare services. And business has changed, evolved and adapted over time. And we now recognise that we need to have some more regulation to ensure the standards and patient safety being delivered through various healthcare services across Gibraltar. What we're doing is looking at the model that the Care Quality Commission uses in the UK and trying to identify the aspects of that will work for Gibraltar. Gibraltar is a very different context. We're a different system. We're a smaller country, so therefore what we need to do is develop something that is proportionate for Gibraltar.
What are you trying to achieve with this commission?
We're trying to achieve providing the public with reassurance that the health and social care services that they receive, whether that's in the private sector or through the government, are safe and delivering of a good quality.
Until now, complaints and issues involving the GHA have been handled by the PAL Service, the Ministry of Health and the Gibraltar Medical and Nursing Registration Boards. Dr. Carter says the new commission could potentially oversee this, but the biggest gap lies in regulating the private sector. I asked Dr. Carter if Gibraltar was a bit behind.
I think compared to the UK, yes we are, but compared to other countries, no. There are similar gaps in the legislation, but even in the UK, they have recognised there is a gap there in terms of the beauty sector and the beauty industry and the growth in treatments that are now offered in that sector. And they too, as has been reported widely in the media, are looking at better regulation, establishing regulation, because up until now, even in the UK, it's been very self-governing industry that it's only going to continue to expand and grow.
Would this commission be able to investigate matters retrospectively, so previous instances of quality of care concerns? Will it go back and sort of look at those cases?
Potentially, yes, especially if there's evidence that there's ongoing harm. You know, if somebody has had a procedure in the past and has suffered physical damage to themselves, for example, as a result of treatment they've received, as we already do, you know, from complaints that come in, for example, to the Gibraltar Medical Registration Board. Some of these can be historical. They can relate to incidents that happened 6 months ago or a few years ago. So these are things that need to be taken into consideration to make sure that whatever the regulatory authority's scope and remit is, it's equitable, it's transparent and it's fair.
How will this change clinical governance at the GHA?
I think the clinical governance department in the GHA has transformed a lot, certainly in the time that I've been here over the last 4 years. We've now got much better governance systems in place, right through from staff awareness of reporting of incidents and near misses is a good thing. We have the whole DATEX system at the GHA. We have a clinical governance department who review those incidents. They look at common themes, root causes. There's a quality of care subcommittee of the board now that meets to review all incidents across all directorates to learn the lessons from those and make recommendations from that.
With the legislation only halfway there, there's currently no time frame for when the commission will be established.